Hello, I'm Dr. D. Grace, Scientist and Chief Prevention Officer here at thecancerdetox.com. Welcome to this episode of the Cancer Prevention Club, where we'll be discussing breast cancer survival rates and how to prevent a recurrence. The Cancer Detox is all about telling people what to do right here, right now, in order to start preventing cancer. We provide you with the tools you need to customize your personal journey to prevention. And we're focusing on natural cancer prevention, no expensive supplements, no rigid diets. As I mentioned, today is all about information and facts that can help you reduce a breast cancer recurrence. We'll talk about reducing fat, vegetable consumption, and flax seeds. Now, over 2.9 million women in the US have a history of breast cancer. Approximately 23% of women with breast cancer will have a recurrence within a 15-year period after their initial diagnosis. Breast cancer recurrence or the development of a new cancer at a different body site continues to be a risk for breast cancer patients. Women with disease know that it is expensive to treat and increases their chances of death. Therefore, avoiding another breast cancer diagnosis is imperative to most survivors. New science based evidence is showing that lifestyle choices and natural cancer fighting foods may lower the risk of a breast cancer recurrence. So, you will find in this presentation those foods that have been shown to help reduce the risk of a breast cancer recurrence. One thing we'll start off with is reducing the amount of fat in the diet. While reducing fat is not a cancer fighting food per se, fat reduction is an important aspect of a diet for breast cancer patients and survivors. Research is showing that fat could be a cancer promoting food. So, eating less fat, especially trans fatty acids, which typically come from processed foods such as donuts and potato chips and pretzels. Reducing trans fatty acids may help to boost your chances of long term survival. A recent scientific study conducted in breast cancer patients taken standard chemotherapy drugs such as tamoxifen, in addition to radiation, showed that women who ate a low calorie, low fat diet had a significant reduction in breast cancer recurrence. This study was called the Women's Intervention Nutrition Study, or the WIN study. Now, the study results show that women who were asked to lower their dietary fat by 15% and were compared to women who did not, they had a significant reduction in breast cancer recurrence by 24%. So, this is quite impressive in terms of just how lowering your amount of dietary fat can also lower your risk of a breast cancer recurrence. Also, another study showed that women who consumed more vegetables, and I know I'm going to sound like a broken record because other episodes have focused in on vegetable consumption, but vegetable consumption is so vitally important. The Well study looked at high vegetable intake and how it correlates to risks of breast cancer recurrence. Vegetables are a foundation for breast cancer patients and survivors. They are rich in essential nutrients and antioxidants. And what we're seeing is that a 31% lower recurrence risk when women ate high amounts of vegetables, and high could mean five or more servings of vegetables a day, in addition to your fruits, can help to reduce your risk of a recurrence. Now, the women in the Well study were also tamoxifen users, and they looked at the high vegetable intake in this particular group, and they found that high vegetable intake in combination with the use of tamoxifen, which is a prescription that a lot of breast cancer patients are on after their breast cancer treatment has ended, appears to lower the risk of a breast cancer recurrence by 44%, which is also quite impressive. So, Encouraging diverse consumption of vegetables is key. One thing the study found is that green leafy vegetables, cruciferous vegetables, as well as lots of different colors of vegetables was important and provided the benefits that we are seeing here. And finally, flax seeds. Flax seeds offer omega 3 fatty acids as well as antioxidants. They're going to support your cellular health. And so they are vital for health. Okay. Flax seeds, although a lot of times they're optional, some people will throw them in some smoothies or put them on top of salads. They actually do provide these healthy omega 3 fatty acids. If you can get them from flax seeds, especially for people who are vegetarian and don't want to get omega 3 fatty acids from cod liver oil or fish oils, certainly flax seeds could be a good option for you, as well as krill. Now, a recent study found that flax seeds could reverse growing breast cancer tumors in newly diagnosed breast cancer patients. The women in the study were diagnosed with breast cancer based on a biopsy, where a sample of the breast tissue was taken and looked at under the microscope. The women were then asked to eat a muffin containing 25 grams of flax seeds, which is about 2 tablespoons of flax seeds. And then a separate group of women were not given the muffin with the flax seeds, and that was considered the placebo group. Now, after eating 30 flaxseed muffins every day for 30 days, that's a muffin a day, not 30 in one day, but a muffin a day. The women in the group who ate the flax seeds showed that their breast cancer cells had increased cell death. They also showed that the production of HER2 cancer types was turned off compared to women who did not eat the flax seeds. And if you recall, in our triple negative breast cancer episode, we talked about HER2 being one of the other two that are in the triple negative breast cancer. So having a HER2 receptor was turned off. And then there was also less growth and proliferation of the breast cancer cells compared to women who did not eat the flax seeds. So the researchers in the study stated our results therefore suggest that the intake of flaxseed has the potential to delay disease progression of pre-invasive or invasive breast cancer by changing the phenotype of the cancer cells to a less aggressive form. So, in conclusion, integrating cancer fighting foods is key, is definitely key if you want to lower your risk of a breast cancer recurrence. So, encourage integration of a variety of different vegetables of all different types of colors. Balanced meals are important. Of course, talk to your healthcare provider or physician. Ask if you can be consulted with a nutritionist to help improve your diet. Also, you want to emphasize a holistic approach to survivorship, physical activity, stress management, social support are all so very vital for reducing that risk of breast cancer recurrence. And finally, remember, empowering survivors to take proactive steps toward wellness is what we're all about at the Cancer Detox. We're not here to treat or diagnose any patient. We're here to provide you with the information so you can therefore make your own informed decision as well as have those informed, educated discussions with your healthcare provider or physician. Thank you so much for listening to this episode of Cancer Prevention Club. I'm Dr. D. Grace, Scientist and Chief Prevention Officer at thecancerdetox.com. If you want to schedule some time with me, you can go to the website and find the calendly.com scheduler. The link is also here on this slide for your information. My new book, Cancer Prevention, The Diet and Lifestyle Habits That Cancer Hates, is also available on Amazon. You can also purchase it at bit.ly/cancer prevention book. Thank you so much again for listening. And as always, stay healthy.